Hello viewers, welcome to NRG Healthcare. I am Dr. A.G. Karthikeyan. So today I am going to discuss about black fungus or mucormycosis. So there are several reports in the medical literature about mucormycosis happening in coronavirus patients. So we are going to discuss as to why these happen more in coronavirus infection, and we are seeing an increase in the number of cases with mucormycosis. So what is mucor? So mucor is a type of fungus which is present everywhere. So literally the fungus present in the form of spores occurs in the soil, in plants, in dust, literally everywhere, and the spores are much more active during the summer months. So they usually enter into our body when we inhale these spores through our nose along with air, but the immune system in our nose and lungs fights against these spores and kills them. Hence, normally we do not get infected with mucormycosis as long as our immune system is good. It's only when our immune system gets weakened, say for example by coronavirus infection, that the mucor spores starts multiplying in our body and starts affecting our body systems. So what are the symptoms of mucormycosis? So as I mentioned, when the fungus spore enters into a weakened immune system body, they can have 4 different ways of affecting them. The most common method of affecting in coronavirus patient is called rhino-oculocerebral mucormycosis. So rhino indicates that the infection affects the nose and the sinuses, which are on both sides of the nose. In medical literature it's called rhino. The ocular refers to the eyes and the cerebro refers to the brain. So the fungus spores enters into our nasal cavity and then spreads into the sinuses here, and then into the eyes, and then into the brain. So this manifestation is called rhino-oculocerebral mucormycosis. So depending on the organ involved, the symptoms can be you can start off with a nasal block or a sinus pain. So patients can have pain on both sides of the nose, or they can have a headache. When the infection affects the eyes, they can have vision problems, they can have difficulty with moving the eyes, swelling of the eyes, etc. And once it reaches the brain, it can have other symptoms like confusion, drowsiness, and even seizures in some patients. So this is the most common method of infection in patients with coronavirus infection, because their immune system is quite compromised. The next organ to be affected is the lungs. Say the spores, when we inhale them, escape the nasal cavity and reaches the lung. So the spores can multiply inside the lungs and severely affects the lung. This again is more common in coronavirus infection, as many of these patients have COVID pneumonia, and the lungs, which are already compromised due to pneumonia, can be easily affected by mucor infection. The third organ is through the skin. So normally when there is a small injury to the skin, the mucor fungus enters through the cracks in the skin and then starts affecting the skin. So this usually results in the black pictures you see, because there is a lot of tissue destruction, and once the tissue gets destroyed, it turns black in color, hence the name black fungus. The fourth method of transmission is called as a bloodstream spread. This is a very rare event where the fungus actually enters into the blood of the individual and then starts spreading to other organs in the body like the kidneys or the liver, etc. This is a very rare event. So why is this more common in coronavirus infection? So there are a number of reasons why mucormycosis is much more common in coronavirus infection. The first reason is probably the use of the steroids. Steroids are extensively used in coronavirus infected patients. Steroids generally suppress the immune system, and hence this makes the patients more vulnerable to mucormycosis. The second is many of these patients on steroids, they develop a high blood sugar as a complication of steroid. High blood sugar is a very good nutrient for the mucormycosis to multiply inside our body. So hence uncontrolled high sugars is a risk factor for mucormycosis, and this happens in coronavirus infected patients. The third reason is a lot of diabetics in our country develop coronavirus infection. As a result, many of these patients have high blood sugar level, and it is very difficult to control their sugars when steroid treatment is started. Hence, they become more vulnerable to mucormycosis. In fact, studies have shown that nearly 85% of patients with mucormycosis have diabetes. So, how do we prevent this condition? So, prevention is paramount. Ideally, we should be able to stop steroids as early as possible. Do not over-treat patients with steroids. Always consult your doctor whether steroids could be stopped as early as possible in patients with coronavirus infection. The second thing is, if you are a diabetic, do check your blood sugars regularly and make sure your blood sugar is under control. The third thing is, do not share masks or medical equipment as much as possible. So try and use disposable items, single-use items as much as possible. A fourth method would be to avoid sharing ventilator circuits or CPAP circuits in hospitals. So they need to be a strictly single patient use and should be discarded after the patients have improved. So what is the treatment of mucormycosis? So the mainstay of treatment of mucormycosis is antifungal medicine called liposomal amphotericin B. So there are a few other antifungal medicines which can be used apart from liposomal amphotericin B. Some patients will require extensive surgery if the mucormycosis has spread. For example, if it has spread to the sinuses or to the eyes, they need more extensive surgery. The mortality is very high, so that is the reason why we need to be very careful about mucormycosis affecting our body. So roughly the death rate is about 50 to 55%. So that is 1 in 2 individuals who develop mucormycosis die. So this is a very sad statistic, and hence the reason for this video as to create an awareness about prevention of mucormycosis. So if you like this video, share this video with your family and friends. Please subscribe to our channel NRG Healthcare. Click on the bell notification to get more updates like this. If you have any comments, please post them in the comment section. I'll be happy to answer your questions if you have any doubts. Thank you so much.